Without further ado, I would really like to introduce you to Dr. Feldman. So, Dr. Feldman developed this kind of medical legal consulting over 10 years ago and has since taught hundreds of physicians just like you how to tap into this lucrative industry. So, if you would like to know how to increase your income and practice enjoyment, give you more freedom and flexibility doing non clinical consulting, you can learn about it today and you are in the right place. So I'd like to hand over to Dr. Feldman, and I will be back to moderate all your questions as we go through. So Dr. Feldman, over to you.
Thank you, Kate. And as always, thanks for doing such a great job as the moderator of our webinars. And thanks to all of you for joining this webinar. I know we have an interesting topic today. I thought that I would start with a very brief introduction about medical legal consulting and what it's all about for those of you who may not have been on a past webinar or may not have talked with me by phone sometime in the past. So what as Kate said, I've actually been doing this work for 12 years. I've been training others for 10. And I actually started this field 12 years ago and have refined it over the years. And now it's recognized as a new subspecialty of forensic medicine. So what I do is I answer any kind of medical question that an attorney has in a case. A couple of things that I don't do. I don't do any expert witness work, and I don't participate in medical malpractice cases. All of the work is pre-trial, pre-litigation. I consult, and you can consult on personal injury cases and workers' compensation cases, although I will tell you any physician in any specialty can do this and can be trained and learn how to do this kind of medical legal consulting. In fact, one of the things that makes this kind of consulting viable and makes it go is that in these areas of the law, personal injury and workers' compensation, probably 9 out of every 10 cases settle. And that's where we come in. What we do is we help attorneys to settle cases for better value and save attorney time. I always work on the side of the little guy going up against the insurance companies. In fact, often their own insurance company, who is denying legitimate claims. In the PI cases, I work on the plaintiff side, and in the workers' comp cases, I work on the claimant side. Bottom line, we help attorneys to settle their cases for more money with less attorney time, and we help attorneys get the appropriate medical care for their clients. You see, I act as a medical consultant in legal cases. I don't act as a medical expert. In fact, there really is a huge difference between a medical consultant and a medical expert. As you all know, for years, there have been physicians acting as medical experts. The interesting thing is, until I started doing this 12 years ago, there certainly were medical experts, but there were not physicians acting as medical consultants to attorneys to help them in the pretrial, pre-litigation phase of the case, and particularly in these areas of the law where 9 out of 10 cases settle. Now, obviously, if the case is going to go to trial and the attorney is going to do depositions and go to court, then they're going to need the appropriate medical experts in every area of injury. But for the purpose of helping the attorney to negotiate and settle the case, what the attorney needs are well thought out, well reasoned, well researched medical opinions, reports, and other services that are going to help the attorney to better negotiate and settle the case for increased value with less attorney time, and help the attorney get the appropriate medical care for their clients. So specifically, what does that mean? Here are some of the services that I offer. What we're going to be talking about today is based on a medical summary report that I did earlier this year. And the medical summary reports can be used in two ways. First, some attorneys will use them to do the medical case coordination, but far and away, attorneys ask me to prepare medical summary reports to include as part of their settlement demand letter. In fact, I have some firms that ask me to provide a medical summary report for every case they take in. Something that runs a close second to that service is I actually physically sit in and observe independent medical exams done by other physicians. And when appropriate, I write IME rebuttal reports. We won't be talking specifically about that today. Another service that I offer is I answer specific medical questions in cases. Something else I do is, although I don't participate in medical malpractice cases, I will do standard of care reviews. Once that standard of care review is done, then I'm out of the case. Something else I do is I actually help attorneys find medical experts for cases. I also act as a liaison between attorneys and treating doctors. And there are many reasons why attorneys would have me do this. One common reason would be to meet with a treating doctor to make sure that that treating doctor would be on board with the attorney's medical theory of the case regarding causation of an injury. I can also do straight up medical research and provide attorneys with current medical journal articles. I write reports that are specific to the determination of future medical care and costs. I help attorneys develop their medical theories for cases. And I also can prepare questions that the attorney will then use when they do depositions or question experts at trial or question independent medical exam physicians. And there are a whole variety of other services that I offer and that you can offer. So with that background, let's get into the case. That's what we presented and advertised for this webinar, that we go over an actual case. And the reason I chose this case is this case is very typical of the kind of cases that you'll do. So very briefly, this is a 39-year-old woman who was broadsided at an intersection. The offending vehicle was traveling at a high rate of speed and traveling against a red light. The client sustained multiple injuries and presented with several ongoing medical problems, including migraine headaches, neck pain, and low back pain. She was seen immediately after the accident in the emergency room and then released and referred to her primary care physician for follow-up care. The attorney wanted me to review the medical records and essentially make sense of the medical issues for him, and then prepare a comprehensive medical summary report with my medical opinions, backed up by evidence from the medical literature for his settlement demand letter. In preparation for a settlement, the attorney must provide a settlement demand letter. In most states, there is a standardized format for this. And in that settlement demand letter, one of the things that the attorney needs to present are the damages in the case. There are many kinds of damages. Obviously, damage to a vehicle, loss of work time, loss of enjoyment of life. What I deal with as a medical consultant are the medical damages in the case. So for those of you who have been on past webinars, you know I've discussed in detail the actual components of a medical summary report, and we're not going to get into that today. The attorney eventually settled this case using my stated medical opinions to a reasonable degree of medical probability regarding the medical damages and the future medical care and costs outlined in my report. So you can request a copy of my medical summary report for this case. Just send me an email to armin@golegaldoc.com, and I'll be happy to email back to you the actual medical summary report that I prepared for this case. Okay, the client was left with 3 serious ongoing medical problems. Now, you can break every bone in your body in an accident, but if everything heals up by the time of the settlement, you certainly have damages, but your damages are not as great as when you have ongoing medical problems at the end of the case when the settlement occurs, and that is typically the case. So first, this client had frequent severe migraine headaches occurring 1 to 3 times per week. The headaches were characterized by bilateral head pain greater on the right, described as sharp and throbbing pain, along with nausea, vomiting, dizziness, photophobia, and sensitivity to sound. Each headache could last up to 24 hours, and the client complained of 5 to 6 over 10 pain on an average day with an average migraine headache. Now, it should be noted that the client reported hitting her head on the driver's side window during the crash, and she reported that she may have had a brief loss of consciousness. Immediately after impact, she complained of headache, dizziness, and nausea to the ambulance paramedics. In addition, the client had constant midline neck pain with radiation to the bilateral upper extremities, and the pain was described as 5 over 6, associated with paresthesias to the shoulders and upper extremities, greater on the left side. An MRI was done about 4 weeks after the accident, and the MRI showed a C4, C5 disc herniation with nerve root impingement bilaterally. And finally, the client reported intermittent 3 over 10 low back pain and numbness radiating to the left lower extremity. A lumbar MRI, also done 4 weeks after the accident, showed an L4, L5 disc herniation with left-sided nerve root impingement. Now, the first thing to note is that this case is due to an auto crash. It is likely that auto accidents will be your most frequent kind of case. Now, in writing reports, I don't call auto accidents by that description or by calling them MVAs or motor vehicle accidents, but rather I use auto crash, which is much more descriptive. Whenever possible, when writing your reports, you want to paint a mental picture with your words, including the client's injuries and of the accident and of the client's functional losses. And that's why I use auto crash and not auto accident, which is much less descriptive. And actually, it's much less accurate. In auto accidents, there are some typical injuries that you'll encounter. This case exemplifies some of those typical injuries, including neck and back injuries and headaches. Now, other kinds of typical injuries that I've seen over the years in auto crashes include mild traumatic brain injuries, fractures, soft tissue injuries, whiplash injuries, quite frequently temporomandibular joint disruption, particularly in rear end accidents, injuries related to seatbelts, like thoracic outlet syndrome, and injuries related to airbags. Now, please note, I labeled the woman in my report as a client and not a patient. Often, physicians who are just starting out with this work will refer to the injured person as a patient in their reports. And you don't want to do that. The injured person is the client of the attorney and not a patient of mine. Remember, your client is always the attorney, not the client of the attorney. As well, I noted in my report that all of my opinions are to a reasonable degree of medical probability. I've given the attorney my opinions to the best of my abilities. Now, you may not actually agree with my opinions. If you had read the medical records in this case, you may have developed different opinions. And actually, I don't want to argue with you today about my opinions and if you think they are correct or not, because I realize that my conclusions are only my opinions, and you or other doctors may have drawn differing opinions based on other different ones than the ones that I concluded. In fact, that's what legal cases are all about. In attorney lingo, there's a fact pattern, and then each side takes the facts and does their best job to develop their legal theories of the case. My interpretation of the medical fact pattern was used by the attorney in his effort to develop his medical theories for the case and then negotiate a settlement. Now, next thing to note is that the client in this case had multiple injuries. As I said, multiple injuries tend to be the norm. You'll be asked to sort out the medical records, including sorting out the different opinions of treating and evaluating doctors, along with your interview of the attorney's client. I always interview the attorney's client in every case. 95% of the time, I'll do that by phone. On those rare occasions when I feel I absolutely need to see the client in person, I'll do that interview at the client's office, at the attorney's office in their conference room. And then evaluating all the other data, then you need to present a cohesive and comprehensive picture of the case, including your medical opinions regarding the injuries. Your job is really to synthesize all the data and then draw your own conclusions. Now, obviously, you're going to pay close attention to what the treating doctors and other doctors are saying, but in the final analysis, your job is really to synthesize all the data. And it's not that unusual that by having this view of the total case, that I may pick up a diagnosis that hasn't been presented in the medical records. Neck and back injuries are the most common injuries that you'll encounter doing this type of consulting. This client had significant neck and back injuries, and particularly significant neck injuries. Sorry, you just heard my assistants in the background. One of the great things about doing this kind of work is I've actually worked out of a home office for the entire 12 years that I've done this. So occasionally my assistants will bark in the background. Typical neck injuries, in fact, typical neck and back injuries include disc herniation, facet injuries, strains and sprains, and myofascial injuries. So you'll need to acquaint yourself with spine anatomy and pathology, such as the difference between a disc bulge, protrusion, and herniation. It's useful to learn about annular tears. It's also helpful to learn about the typical pain problems associated with trauma to the neck and back. One important thing to be aware of is that neck and back pain can be mediated by mechanical dysfunction such as nerve root impingement. And here's the point, and can be mediated by biochemical changes at the cellular level, such as biochemically induced pain due to the extrusion of disc material with an annular tear. In addition, it'll be helpful for you to familiarize yourself with the various tests and the names of those tests that are typically done in an orthopedic and physical medicine exam, like range of motion testing, straight leg raising, Sperling maneuvers, Hawkins, Faber tests, and many, many more. But here's what I want to tell you. I don't want you to become concerned with having to spend time studying or going back to your textbooks before you start your medical legal consulting business. There's a saying, right? Necessity is the mother of invention. So you'll learn the medicine that you need to know as you are presented with cases. In fact, that's certainly how I did it. As I've said many, many times, one of the real pleasures of this work is the opportunity to learn a lot about a lot of various aspects of medicine and enjoy the experience of intellectual curiosity and continuous learning. I know that based on all of the medical research that I've done over these past 12 years, I'm certainly a better rounded and I think a better doctor for doing that. Now, of course, I'm not prepared to do any orthopedic or neurologic surgery, but part of the fun of this, I certainly put my knowledge base of spine injuries, or for that matter, rotator cuff injuries, up against anyone. And that's really been a lot of the fun of the work. As many of you know, I'm trained as a psychiatrist. My area of specialty was mild traumatic brain injury. If someone now asked me what my specialty is, having done this for 12 years and started this new field, I would say it's forensic medicine, but that's my background. But I've had the opportunity to learn a tremendous amount of medicine, actually got paid to do it. And it's part of the fun and enjoyment of doing this kind of work. As I mentioned a moment ago, this case illustrates a typical problem after neck and back injuries, and that's ongoing pain. In this case, the client had objective MRI evidence of nerve root impingement, and certainly, in my opinion, biochemically mediated pain due to tissue damage as well. Neuropathic neck pain is typically caused by mechanical impingement of nerve roots, mechanical impingement on the cord, facet joint disruption, disc herniation, and or biochemically mediated pain due to tissue damage, including myofascial soft tissue injuries. I'm surprised at how often I encounter cases in which there's been a disc herniation and the MRI doesn't show mechanical impingement, and an independent medical exam physician in their report will state the client's pain couldn't possibly be due to the disc herniation because there's no impingement on the nerve root of the cord. When you get the appropriate case, I strongly urge you to read the literature on biochemically mediated nerve pain due to tissue damage. There's actually a huge body of literature on this topic, and you're going to quote it in your cases. In addition, the client had significant myofascial damage that could be documented through physical exam, ultrasound, and response to treatment. As I've said, it's always helpful if you have objective findings that support your opinions. Of course, you want to note the objective findings that are in the medical record that support those opinions. And I put those findings both in the verbatim record section and in the discussion section of your reports. So I'll typically look to see if there are CT scans or MRIs or ultrasound imaging that can help me to objectify the client's neck and back complaints. Of course, I also want to see, as I said, what conclusions the client's treating doctors have reached, and specifically see the results of their physical exams. I actually spend a lot of time reading the actual physical exam notes in the records. If an IME has been done, it's not uncommon for the IME doctor and the treating doctor to reach different conclusions about the client's pain and functionality. Remember, you're basing your opinions on what you read in the medical records, your interview with the client, and your review of the pertinent medical literature, and then the key point, synthesizing all the data. In this case, it was my opinion the client's neck pain was related to nerve root impingement, biochemically mediated nerve root pain, facet arthrosis, and myofascial tissue injury. In almost every medical summary report, you'll also give your opinion regarding mechanism of action of the injury for each injury in the case. In this case, it was my opinion the client suffered a whiplash injury to the neck. It was also my opinion the whiplash event caused the disc herniation, joint injuries, and the neck muscle and connective tissue injuries as well. Ongoing pain is a very common complaint after an accident, as it was in this case. Obviously, pain is a completely subjective experience. Now, despite pain being subjective, it's useful in almost every case to ask the client to rate their pain on a pain rating scale from 0 to 10. So when I'm talking to the client, what I'll say is 0 means you have no pain. 7 means you have pain bad enough it's keeping you up at night. 9 means you have pain that's bad enough you're on your way to the emergency room. And 10 is pain bad enough that you've passed out. Now, in my report, I'm going to say 0 represents no pain, and 10 represents pain severe enough to lose consciousness. So let me give you a quick example. One of the things that I do is almost every attorney, if their client is going to attend an independent medical exam, will have an IME prep meeting. And I have many attorneys that ask me to participate in that IME prep meeting, either by phone or in person, depending on the case. So first, the attorney will go over a number of legal issues and counsel their client with regard to the IME. And then typically they will turn the meeting over to me, and I will then act in a role play as the IME doctor and start questioning the client. So I'll go through the same issue with, or same scale with the client. And okay, the 0 is no pain, 7 is keeping you up, 9 you're on your way to the emergency room, 10 you passed out. What's your pain? And for example, let's say the client says, well, doc, my pain's a 9 or a 10. And I'll say, well, that means that almost every day you're on to the emergency room or you've passed out. Is that correct? And the client says, well, no, doc, that's not correct. But I want to make sure that this doctor knows I'm really in a lot of pain. So I'll say to the client, look, if you tell the examining doctor that you're always a 9 or 10, first of all, they're not going to believe you. They're either going to think you're exaggerating or lying. Now, listen to this again, and I'll go through the scale again. Okay, now tell me, based on that, what's your pain? Oh, okay, doctor. Well, I would say then on an average day, my pain is a 6. And that's one way to use this pain scale. And it also is what happens in these prep meetings. In hospital settings, pain is now considered the 5th vital sign. It's well known that patients with significant pain have more difficult surgical recoveries and are slower to heal from injuries. The experience of pain is influenced by age, culture, gender, ethnic background, affect, psychological makeup, the nature of the injury, a person's reaction to unexpected trauma, and other factors. Pain also affects the quality of life through its effect on such things as mood, activity, degree of social interaction, appetite, sleep, hygiene, and the ability to focus and concentrate. You want to discuss in your reports how pain affects these things. And as I said, you want to paint a picture of how the client's life is being disrupted. Every person's experience of pain is different. A patient isn't necessarily exhibiting exaggerated pain behaviors because their degree of pain is higher than what one would expect from the quote average patient. Clearly, as physicians, we know there's a continuum of pain response. I'm often asked to comment on the client's pain, and I'll use some variation of the following language. It's my opinion Mr. Doe's general behavior and demeanor during the IME were completely within what one would expect from an individual with severe pain. In my opinion, Mr. Doe did not show evidence of exaggerated pain behaviors. Okay, finally, let's talk about objectivity. Sometimes I'm asked by doctors thinking about doing this work about being a quote hired gun. One of the great things about being on this side of the fence, that is, helping plaintiff and claimant attorneys, is that these attorneys want and value our straight up medical opinions. These attorneys don't want to be carrying loser cases with their time and with their money. Typically, when I tell an attorney I don't think that they have a case, for whatever the reason, pre-existing condition, malingering, driven by secondary gain, something else. When I tell the attorney that they don't have a case, at that point, I deliver my report, written or verbal, and I'm out of the case. What the attorney typically will do is they'll try to settle that case for whatever they can, as quickly as they can, for whatever they can get. I never have the kind of secondary gain issues that may confront some of the IME docs. Okay, next I'm going to open it up for your questions. However, this question comes up in every webinar, so I thought I'd answer it now. If you are interested in doing this kind of consulting, I would suggest that you join my medical legal consulting coaching program. The coaching program is a year-long collaboration designed to maximize your efforts. You not only get my complete business solution and all my experience and all the tools that go with it, you have me coaching all along the way. You get your own virtual back office. That's where all your tools of the trade are kept, in addition to individual coaching with me. Physicians can do this work full-time as part of an existing practice or in lieu of retiring. So let me help you to make an exponential gain in your efforts and have a long-term, highly successful medical legal consulting business. I'll help you to duplicate my very successful 12-year-old medical legal consulting business in your location. As many of you may know, every one of these consulting businesses is a local business. For more information about the coaching program, you can put your information into the chat box, or you can email me at armin@golegaldoc.com, or you can call me at 303-619-0777. I'll need your name, your cell number, and your email address to respond to your inquiry. Sometimes people forget that again. I'll need your name, cell number, and email address to respond to your inquiry. Okay, what questions can I answer for you about this case, writing medical summary reports, or any other issue regarding doing medical legal consulting?
Wonderful. Thank you so much for that, Dr. Feldman. Absolutely fascinating. And we have had a couple of questions come in already. And we've also had people saying that they are definitely intrigued by what you're saying and will be in contact. So that's fantastic. So for anybody who does want to get in contact with Dr. Feldman, please do email armin@golegaldoc.com or call 303-619-0777. And don't forget to include your name, your cell number, and your email address. So in the meantime, let's answer some of your questions. So the first question, Dr. Feldman, came in from Jeff. And Jeff asked, have you done any corporate/pharma consulting?
I haven't. The only pharma, not specifically for big pharma, but first of all, I don't do court cases, right? All of my work is on the cases that don't go to court. But I certainly have had cases in which there are questions about the use of or the not the use of medication or the toxicity of medications. Or the misuse of medications.
Okay, thank you very much. Hopefully that answered your question, Jeff. Michael has asked, why don't you do med-mal cases, Dr. Feldman?
Can you hear me? Yeah, you can hear me. It's a personal preference. I will do standard of care reviews because I know somebody's going to do that standard of care review. And if somebody's going to do it, I would just hate to say it, I just as soon it be me. I know that I'll do a fair and honest job, and I've certainly been able to help some physicians avoid a lot of misery, although that doesn't mean that I haven't read about some terrible things that have happened. But there, for the grace of God, go I. I just don't want to participate in med-mal cases.
Wonderful. So Sonali has asked, how much time do you spend on a typical case?
Yes, that is a great question, and I can answer that for you. The average case, unlike doing medical expert work, the average case doing this kind of work will take 5 to 10 hours. I think I spent 9 hours on this particular case that I'm talking about, including writing the report. If you have a particularly complicated report to write, you may get up to 12 hours, but 15 hours, but the average case is going to take 5 to 10 hours.
Okay, thank you. Neil has asked, how many cases do you tend to have running simultaneously?
Yes, Neil, I have, in all the years that I've done this, I have never measured cases. The only thing that I measure is how many hours a week am I working and how many billable hours do I have per week. So when I was doing this work before I was training others, I was working about 50 hours a week. And I couldn't even tell you how many cases that translates into. I can tell you, I actually added it up. I've actually done over 2,000 cases.
Okay, good to know. So, Gerard has asked, how do you refer for cases that do require an expert witness for malpractice?
Yeah, if the case is going to trial and the attorney is going to do depositions and go to court because the case just can't be settled, then what happens is, obviously, all of these attorneys do have their, first of all, there are two kinds of experts, right? There are treating doctors who are experts, and then there are what are called retained experts. And all of the attorneys do have their favorite go-to retained experts that they use. But obviously, they don't have experts in every possible medical situation. And that's where I come in. I did a case on a malignant melanoma case, and this was a standard of care review. I won't go into the whole case, but I wound up using a textbook. There was one chapter on malignant melanoma that I used as my base of information, and then went out to other literature. But the attorney needed an expert in that case. So I actually called the guy that wrote the chapter of that book. He happened to be in private practice in Milwaukee, and he wound up acting as the expert in that case in Denver, and I was the one that facilitated that.
Lovely. So Tom has asked, during this year of coaching, will we write the first few reports more or less together?
So here's how I do that. You'll get the case. You're happy. You're welcome to discuss the case with me. We can go over the case. And then in your back office, by the way, you have a little over 30 sample reports. And there's several, for example, medical summary reports. So take a look at the reports in your back office, discuss the case with me, and then prepare a draft. And then what almost all the physicians in the coaching program will do is they'll send me their drafts of their reports. And you're welcome to do it the whole year. Obviously, most of the physicians will send me reports in the first several months that we work together, and I'll review that report. And I always make my suggestions in red, my comments in blue. And it's not rocket science, but there is a learning curve, and there is a language to use. There is some law to learn, and there is a way to properly frame what you're writing, and I'll help you with that as you start writing your reports.
Sonali has asked, how do you determine the rate that you charge?
So that's a good question. And the answer is, the way I've been advising physicians over the years is do an informal survey of your colleagues. You may know this already, but do an informal survey of your colleagues. Determine what you think is the average fee per hour for doing medical expert work in your community. Now, obviously, there's a range, but it really isn't that hard to figure the average. Once you have that average, for doing medical consulting work, you want to be somewhere between half and 2/3 of that average. When doctors and lawyers think about lawyers hiring doctors, they really only think of one thing, and that is hiring expert witnesses. And so that's the only thing that they have to compare your fee against. And so what I recommend is you come in below the prevailing rates for medical experts. You really need to in doing this broader kind of work. I think you'll be very pleasantly surprised at what that turns out to be as an hourly rate. I charge one single hourly rate for everything I do, whether it's medical research, talking to the client, attending an IME, talking to the attorney, whatever it is. I have one hourly rate. And attorneys are very familiar with hourly billing. In fact, they bill by increments of the hour. Most of them, by the way, around here bill by increments of 1/6 of an hour. I bill by increments of quarter hours. They're very familiar with that. And that's how I bill. By the way, I send my bill immediately when I finish my service. If I send my bill with my report, or if there's no report, I'll send my bill at the time I complete my service. And the attorneys with whom I work, they understand that I am on their team, and I expect to be paid, and the attorney pays me directly. I expect to be paid within the next 30 days. I'm typically paid in the next 30 to 60 days. The attorneys understand I am not part of the problem at an end of a case. where there may not be enough money to pay all the treating doctors in full. I never wait to the end of the case to be paid. I never I'm paid on contingency. I'm part of the attorney's team. I expect to be paid as such. And I am part of the solution to the settlement. I am not part of the problem at the end of the case where there may be a limited amount of money to pay treating doctors.
Wonderful. That's really good to know. So the questions are coming in thick and fast. Please do keep popping them in the chat box and we will get through as many as we can. This is obviously, we know how fascinating and lucrative this field is. So, your questions are really fantastic. Michael has asked, as a neuroradiologist, would my background exclude me from this work or be regarded as beneficial?
It really doesn't matter what your specialty is. I am very rare. Of course, now I've been working with attorneys for years, but in the early years, I was very rarely asked about my specialty. The attorneys are much more interested in knowing if your medical opinions, reports, and other services are going to get them to the settlement, first of all, and then get them to the settlement with a better settlement with more money and help them get the appropriate medical care for their clients, do it at a reasonable fee, and save them time. So what's much more critical is some physicians, they like to stay in their lane, right? They don't care about anything but what they're doing. But if you enjoy medicine and you have some intellectual curiosity and enjoy the process of lifelong learning, and don't mind going to the literature and researching something, then this work is for you. So your specialty doesn't really matter. Let me give you an example. So let's say that I write a report regarding a rotator cuff injury. Now, this doesn't happen to me much anymore, but in the early years, my report, by the way, my reports, your reports, they're certainly going to be seen by opposing counsel. They're usually seen by insurance adjusters. They're often seen by the judges, treating doctors, IME doctors, and others. They're not behind the scenes. So the attorney that hired me, I write a report, I give my medical opinions to a reasonable degree of medical probability, I quote the literature, and they send that report to opposing counsel. Well, what's opposing counsel going to do? First thing they're going to do is look me up, right? So they'll come back to they don't do this much anymore, but in the early years, they come back to the attorney and say, well, wait a minute, Dr. Feldman isn't a specialist in rotator cuffs. And what the attorney that hires me is going to say is, well, Dr. Feldman acts as a medical consultant for me in all my cases. And I can tell you, if you force me to take this case to trial, when I hire my retained expert is going to say exactly what Dr. Feldman said in his case. He's using the exact same literature that my expert's going to use at trial. So let's get this settled. And that's how it works in practical terms.
That's good to know. Lily has asked, are you subject to legal malpractice lawsuits by reviewing these cases? Is your name used on the cases?
My name is used on the cases. And as I said, these reports are passed around. People know who I am and what I'm doing. Now, here's the answer to your question. There are two answers to your question. Here's the bottom line answer. If you are concerned about that, what you should do is hire an attorney in your state, probably only take the person a couple of hours, and ask them to give you a written opinion about that. Once you have a written opinion, you're also backed up by their malpractice. But so that's the bottom line. Here's the other opinion. I'm not an attorney. Let's make that clear. But I don't really think you need medical malpractice to do this. What I am hired, I've done this 12 years. I've never come close to anyone even threatening a sniff of a suit. I think I do a good job. I suppose I could be sued otherwise. But what I'm hired to, all my clients, by the way, are attorneys. They certainly know how to sue people. But what I am hired to do is render medical opinions. And as long as I render my medical opinion in good faith, so I actually read the medical records, I do the research that's required, I write a proper report, I give it the right amount of thought and reasoning. Even if the attorney didn't like your opinion, which I don't think it's ever happened, because whatever your opinion is, it's a good opinion because they don't want to have a run with a bad case. But if you're hired to render your medical opinion, you render it in good faith. It's very hard to sue someone when you hired them to render an opinion and they render one.
Okay. Sonali has asked, when you interview the client, are you doing any sort of exam, whether mental status or physical?
Yeah, I don't do any physical exams. When obviously the first thing I do is talk to the attorney, discuss the case, and then the attorney sends me the medical records. I read the medical records. Then the next thing I do is I interview the client. And what I'm doing is clarifying the medical records and getting a careful history. Because when I write my reports, I just don't quote the medical record. I also say the client stated, the client reports. So my job isn't just to review the medical records and regurgitate them. My real job is to synthesize all that data and give my opinions on the case.
Good to know. Jan has asked, how do you know if a disc abnormality, bulge, protrusion, extrusion, herniation, annular tear is related to an accident if there was no prior imaging? How do you determine conclusively if a disc abnormality is acute?
Yeah, that's a good question. And I'm not going to get into the details of it here. But what you're talking about is in the legal world is called causation. And there is a whole body of literature, by the way, on how to determine causation in accident cases. And I use that literature as my guideline in the determination of causation. And I render my medical opinion to a reasonable degree of medical probability and determine if the injuries or if the situation, whatever's causing the mechanism of injury is the immediate and proximate cause of the injury.
Dale has asked, how much traveling do you do weekly regarding your work?
As I said earlier, every one of these businesses is a local business. So by the nature of the business, by the nature of the marketing for the business, it makes absolutely no sense. In fact, it's impractical to try to solicit business from attorneys outside of your local area. You'll have plenty of demand in your local area to keep you busy. So the only traveling really that I do is to attorney offices to observe independent medical exams. And of course, you could do this virtually, but I actually like to go to the University of Colorado Health Sciences Center Med School Library to do my research.
Wonderful. So Ken has asked, what do you charge for the coaching program?
I will be happy to tell you about that. I will tell you that I'm always a little reluctant to talk about fees before. Usually I have a process to do this, so you know what it is that you're buying. So I'm going to give you the fee, but at this point, you really don't know what it is that you're buying. So send me an email, and what I'll send back to you is a 6-page written description of what's in the coaching program. But here's the fee. There's an initial registration fee. It is $6,000. Starting 30 days later, there is a monthly back office fee. That's $500 a month. That is for 1 year. At the end of the year, the contract ends. There are no other costs or fees. Certainly long before the end of the year, you will be quite proficient at doing this. Now, in terms of rate of return on investment, based on what we were talking about earlier, you can expect to recoup your initial investment, depending on what you're charging, but even in the range, you should be able to recoup your initial investment in 2 to 3 cases. And then if you do just 2 to 3 cases a month for the year that we work together, your rate of return on investment for your entire year's fee, I've calculated it out, it's a 700% rate of return on investment. So that's the fee. By the way, at the end of the first year, if you would like to keep your virtual back office open, keep your website up that comes with the program, keep your connection to the other physicians around the country doing this through our listserv, and your connection to me after that first year, there's a small fee. It's $100 a month. You get everything you get in the first year. And at that point, you can quit anytime. I'd say about half the physicians stay with me more than a year.
That's really good to know. And I can certainly speak from experience that the amount of value that your students get from the program is absolutely enormous. So really great to know that. So Dina has asked, do you frequently get asked to go to court as the client had already paid for your hours in consult, and that would save time and they know your opinions? If you let them know this prior to your retainer, does that seem to keep some from using you?
So I never go to court. Medical experts will go to court. You see, everybody is willing, and this is legal language, everybody's willing to stipulate. The attorney that hires me, even opposing counsel, is willing to stipulate Dr. Feldman is not an expert in all areas of medicine. So I never go to court. My value is in those 9 out of 10 cases that never, ever go to court. That's where I come in.
Wonderful.
In fact, Kate, I'll say in 12 years of doing this, I have never been deposed. I've acted as an expert once, and I did it as a favor to the attorney. So that's not what this is about.
Wonderful. So we've got about 1 minute left until we're at the top of the hour. So if anybody has any final questions, please do submit them into the chat box and we will answer those as we start to wrap up as well. And of course, don't forget that if you would like more information about the coaching program and would like to work with Dr. Feldman, then please email armin@golegaldoc.com or call 303-619-0777. And don't forget, when you email Dr. Feldman for more information, please do include your email address, your cell phone number, and of course your name. So the final couple of questions that have come through in the chat for today. Dale has asked, for a typical report, how many pages do you submit?
Depends on what the service is. So a medical summary report probably will have the most pages, 8 to 12 to 15. If I'm answering a specific question in a case, maybe it's 5 or 6 pages. If I'm writing an IME rebuttal, maybe it's 8 or 10 pages.
Fantastic. And Dale has also asked, don't you have a yearly 2-day seminar, and where is it and what is the fee for it?
Yes. So in addition to the coaching program, I do once a year, I do a 2-day crash course in how to do this kind of work. And in fact, one of the things I say very early in those 2 days is, when you leave this conference, you will have all of the tools and all of the instruction that you need to go home and successfully do this. Obviously, what you won't have is a year of coaching with me. But yes, I do a 2-day conference, and you will be armed and ready when you leave. And this year, or the next one, I should say, is May 2nd and 3rd. It is in Denver. At the Westin DIA right at the airport. You can walk from the plane to the hotel. So that's when the next conference is. If you sign up before the first of the year, the tuition is $12.95. After the first of the year, it's $13.95. And this year, for the first time, we're offering a VIP program too. So with some other things included. So you can take a look at that on the conference website.
Wonderful. Thank you so much, Dr. Feldman, for all of your fantastic information. That has been really fascinating to listen to and go through that case study today. So thank you so much for sharing that with everyone. It's very much appreciated.
Well,
Sorry, you carry on, Dr. Feldman.
Thank you, Kate, and thank all of you for participating. It's a lot of fun.
Fantastic. So I have put the contact information in the chat box for you all there. And I'm also just popping in the link to next year's conference. There's a website that you can go on where you can find out a little bit more information and, of course, secure your ticket. If you are interested in finding out about our VIP packages for that conference, please do email Dr. Feldman and he can send you a little bit more information. We are just starting to ramp up and get the tickets out there, so you will be one of the first to book, which I highly recommend doing because the conference has sold out every single year that Dr. Feldman has run it. So get in there fast and please do email him if you would like to know more about the VIP package. Of course, again, just for the last time, thank you so much, everybody, for joining us. We really appreciate your time today, for coming on and listening to Dr. Feldman's fascinating case study and wanting to find out more about medical and legal consulting. There's the information in the chat box and on your screen right now. But for today, we shall now sign off, say thank you very much, and we hope to see you all soon. Thank you very much.
Thank you.